Hello, my name is Maylin Zambrano and I'm going to talk about quadrupling inhaled glucocorticoid dose to avoid asthma exacerbations. Definition. Asthma is one of the most common chronic diseases, with an estimated 300 million people affected worldwide. Acute exacerbations of asthma are frightening for patients, cause considerable illness and death, and account for a large proportion of the overall costs related to asthma.
In pediatric asthma management, early signs of loss of asthma control often portend an impending exacerbation. This condition is often referred to as entering the yellow zone. Escalation of asthma treatment in the yellow zone has been considered as a way to prevent full-blown exacerbations, but there's limited evidence to support this approach. This randomized double-blind trial involved 254 children, aged 5 to 11 years, with mild to moderate persistent asthma, who were being treated with daily low-dose inhaled glucocorticoids. When they entered the yellow zone, those in the intervention group increased the dose of inhaled glucocorticoids by a factor of 5 for a week. For those in the control group, the dose remained unchanged. The primary outcome was the rate of asthma exacerbations leading to treatment with systemic glucocorticoids. That rate was not significantly different between the two treatment groups, with 0.37 exacerbations per year reported in the low-dose group and 0.48 exacerbations per year in the high-dose group. The growth rate in children randomized to high-dose inhaled glucocorticoids was 0.23 centimeters per year less than in children randomized to low-dose inhaled glucocorticoids. The authors conclude that increasing inhaled glucocorticoid doses five-fold for 7 days at the early signs of loss of asthma control in children with persistent asthma being treated with daily low-dose inhaled glucocorticoid therapy does not significantly reduce exacerbations and may be associated with adverse growth effects in the children.
Application in medicine. The objective of the treatment of a crisis is to preserve the life of the patient, reversing airflow obstruction and hypoxemia as quickly as possible, and later establish or revise the therapeutic plan to prevent new crises, which include a temporary quadrupling of the dose of inhaled glucocorticoids when asthma control started to deteriorate. Pros and cons. In case of persistent refractory respiratory failure or symptoms or signs of severe exacerbation, is the possibility of using non-invasive mechanical ventilation or referring the patient to the ICU for oral-tracheal intubation and mechanical ventilation.
Asthma affects millions of Americans and is typically controlled with medication, but sometimes an asthma attack will strike. Dr. John Ramey explains what to do when your inhaler doesn't work.
If they can't get it relieved with their rescue inhaler, then they need to let someone know. If a patient comes into the office or the emergency room, we can treat them with nebulized medications, which can help. A lot of times these patients need to be on steroid injections or IV steroids to help control their asthma exacerbations.
And don't assume that an asthma diagnosis means you have to suffer through attacks on a regular basis.
If you're using your albuterol, your rescue inhaler, more than twice a week, you really need to see your doctor, because that's an indication that you may need to be on a daily medication.
Doctors at Roper St. Francis participate in research and are constantly working to find the medications that best help patients avoid these types of attacks.
Patients' quality of life improves. They're less likely to miss school or work. They're more likely to be able to sleep at night.
For more information, call 402-CARE, and for more House Calls TV, visit us online at
Issue applied in Ecuador. In Ecuador, it is estimated that asthma affects 7% of the population. According to the figures of the Ecuadorian Institute of Statistics and Census, in 2010 there were 3,275 cases registered in the country of the disease. Conclusion. In this trial involving adults and adolescents with asthma, a personalized self-management plan that include a temporary quadrupling of the dose of inhaled glucocorticoids when asthma control started to deteriorate result in fewer severe asthma exacerbation than a plan in which the dose was not increased.
Inhaled corticosteroids work at many levels in airway disease, such as asthma and chronic obstructive pulmonary disease, or COPD. Within the airways and submucosa, Inhaled corticosteroids have effects on structural elements, such as epithelial cells, endothelial cells, smooth muscle, mucous glands, and cells, as well as actions on inflammatory cells, including eosinophils, lymphocytes, mast cells, macrophages, and dendritic cells. Corticosteroids are small hydrophobic molecules that freely cross the plasma membrane. Glucocorticoids bind to the glucocorticoid receptor in the cytoplasm, and this bound complex moves to the nucleus. Within the nucleus, steroid binds to glucocorticoid response elements, activating a DNA binding site. Within the nucleus, steroids enhance the activity of compounds that reduce transcription of inflammatory proteins. The production of inflammatory cytokines, including interleukins 1, 3, 4, 5, and 8, TNF-alpha, and GM-CSF are reduced. Reduction in cyclooxygenase and phospholipase A2 and an increase in lipocortin-1 reduces production of inflammatory prostaglandins and leukotrienes. Nitric oxide synthetase is reduced, and this leads to a reduction in nitric oxide. Steroids reduce endothelial expression of adhesion molecules and cellular activation and migration, so leukocyte chemotaxis is reduced. Steroids increase endonucleases that increase apoptosis of lymphocytes and eosinophils.